Hi everyone, welcome back to UWorld's Next Gen NCLEX review. My name is Samantha and we are back for another question drill, our last one of the day. So we're going to be covering most missed questions. So we have taken together all of our most missed, our most challenging, and the ones that we've gotten the most requests for more explanation on. So we hope to really do a deep dive into these today, give some more explanation so you guys leave feeling confident. A couple of housekeeping things. We have fabulous Nurse Jackie moderating our chat, so make sure you drop any questions in the chat, any comments you have, as well as, of course, the answers to today's questions that we put up. We are always excited to hear from you guys, so let's get that chat going and warming up. If you haven't followed us, follow us at UWorld Nursing on whatever your preferred social platform is, and keep letting us know the topics that you all want to see us present. We're here to help you, so let us know the best way that we can do that. Alrighty, so with that being said, let's go ahead and get started. We have 8 questions for you all today. Alrighty, so the nurse is screening clients for autism spectrum disorder. It would require follow-up if a 9-month-old client has not developed a strong pincer grasp, 2 17-month-old client cannot kick a ball, 3 24-month-old client lacks spontaneous eye contact, or 4 a 36-month-old client cannot hop on 1 foot. Drop those answers in the chat. Let us know what you all are thinking. In the meantime, who here is already scheduled to take their NCLEX? Let us know when you're testing so we can wish you good luck. And who here has already tested, and let us know so we can congratulate you on passing. We are so happy to have you all here with us today. I feel like our Thursday afternoon lives are usually our most popular, so thank you all for joining. And I see Mal is taking hers next week. Good luck. You're going to do great. Stay calm. Be confident. Ania is taking hers on the 28th. It's coming up. You're going to do great. A couple people are scheduled. John passed last week. Congratulations, John. That's so exciting. And a couple people waiting on that ATT to test. That is definitely a test of patience, but you will get it eventually. All right, so lots of answers coming in, and good news is I see correct options here. So option 3 was what we were looking for here. Autism spectrum disorder, or ASD for short, is a neurobiological and a developmental disorder that's usually apparent in clients by the age of 3. So clinical features of ASD will include impaired social skills and impaired interpersonal communication. Clients will have increased or decreased reactivity to sensory input. They'll have restricted activities and interests, and they'll show repetitive patterns as well as repetitive behaviors. So disinterest in social interaction and inability to show affection are some of our clues to start piecing together the puzzle of autism spectrum disorder. We typically screen clients for this between 18 and 24 months of age, so they're still pretty young. This will be done using standardized screening tool by a healthcare provider. If the screening is concerning, this includes things like lacking spontaneous eye contact. So eye contact develops in our newborn babies as young as about 8 weeks of old. So really, really young infants. This is when they start to smile, they start to connect with their caregiver. So a lack of spontaneous eye contact by 2 years of age or 24 months is going to be very, very concerning, something we definitely want to follow up on with the healthcare provider. Options 1, 2, and 4 are incorrect options because they're not concerning for follow-up. We don't need to take further intervention. So a 9-month-old client in option 1 has not developed a strong pincer grasp. 9 months would be the earliest we would see a pincer grasp develop. It transitions in these young kids from the palmar to a crude pincer to a neat pincer. So that palm is essentially getting further and further and more closed. We're getting more fine in the motor skills. We don't see this fully develop until 11 months of age. So again, at 9-month-old, if we're not mastering this yet, we're not too concerned. Option 2 is 17-month-old client cannot yet kick a ball. We see this develop around 2 years of age or 24 months. So if a client who's 17 months, not even 1.5 years old yet, we're not concerned. And lastly, 4, 36-month-old client cannot hop on 1 foot. Age 4 is when we see this typically develop. So 36 months is just 3 years. Again, we're not concerned yet. So option 3 was our correct option. Way to go, guys. All right, question 2, moving on to some cardio meds. So the nurses taught a client with hypertension who has a new prescription for ramipril. Which of the following statements by the client would require follow-up? So option 1 is going to be, I should discontinue the medication if I develop swelling of my lips or eyes. 2 is, I will avoid taking a potassium supplement with the medication. 3, I can continue taking the medication if I become pregnant. And 4, I may develop a dry cough while taking the medication. Drop those answers in the chats. And so you are all aware, we are doing a webinar with NSNA. We are the official test preparation platform partners of the National Student Nurses Association. Through them, we are putting on 6 virtual webinars throughout the year. Number 2 of 6 is scheduled for this upcoming Monday, May 19th. We're going to be covering case studies, adaptive testing as far as our exam strategy portion goes, and then we're going to be jumping into pharmacology. So really excited about that. You can find more information on our social media, on the NSNA social media, or at uworldnursing.com has links to all of our socials as well. So go ahead and check out uworldnursing.com. And if you haven't followed yet, go ahead and give us a follow. I see April is asking, is this an ACE inhibitor? It is an ACE inhibitor. Way to go. And that maybe gives you a little bit of a hint towards our correct answer. And that correct answer, you guys overwhelmingly got this right, was option number 3. So good job. An ACE inhibitor is a ramipril, a lisinopril, a captopril. These are all antihypertensive medications that are commonly used to decrease ventricular remodeling, and it's used usually in chronic heart failure. So ACE inhibitors alter the RAAS syndrome, the renin angiotensin aldosterone system. And so through this, they also, really important to know, there's a couple major adverse effects. So they're teratogens. They are contraindicated in pregnancy because they can cross that placental barrier and cause some severe congenital anomalies, including skull hypoplasia of that fetus, renal failure, as well as even lead to miscarriage. So in a client that's pregnant or is considering becoming pregnant, we do not want to be on ACE inhibitors. Some antihypertensive meds that are safe to give in an obstetric setting would be a beta blocker like a labetalol, or a calcium channel blocker like a nifedipine, or Procardia is the trade name for that. Alrighty, so we in option 1, I should discontinue the medication if I develop swelling of my lips or eyes. This does not require follow-up because it's a correct statement. So one of the biggest adverse effects of of ACE inhibitors is angioedema, the swelling of the lips or the eyes. And it looks like somebody, Layla, says A for angioedema, C for cough, and E for elevated potassium. Way to go. That is such a great way to remember it. ACE inhibitors will do all of these things. So we have to make sure we are monitoring for any of that angioedema or the signs and symptoms. We would need to discontinue the medication and seek medical attention, notify the healthcare provider. We're also going to avoid potassium supplements because the potential for hyperkalemia. And lastly, we may develop a dry cough on an ACE inhibitors. That is one of the potential side effects. So option 3 was our incorrect statement. Therefore, it requires follow-up, which is why it's our correct answer. Alrighty, so share and follow. Again, this is a great time to share because we're still just getting started for the day. But here we have another cardio question. So the nurse is caring for a client with a new mechanical heart valve. The nurse should expect that the client will be prescribed warfarin, dabigatran, tacrolimus, or apixaban. I see Elias is asking, I want to buy UWorld. How can I get the link? Go to uworldnursing.com. uworldnursing.com has a buy now button. It is bright yellow. It's in the top right-hand corner. You can go ahead and click that and you will get a page with all of our different offerings that you can buy. We hope you guys follow suit. Alrighty, and we're getting into a big testing schedule. So I know June, July are really big testing months. We're right on the precipice. You guys, there's a lot of May graduates, I feel like, so we're really moving towards that. Anyone here that is scheduled for their NCLEX, starting to study, my biggest recommendation is going to be choosing a trusted test preparation platform and sticking with it. The best way to work on your NCLEX skills is to take a self-assessment that finds kind of your area of weakness, and that's where you're going to want to focus on because you're going to see the biggest and the quickest improvements there. All right, great job, you guys. Lots of answers coming in. You guys are doing fabulous today. Someone says stuck between 1 and 4. Pharmacology questions are tricky questions. So our correct option here was option number 1, that warfarin. So we're talking about heart valve replacement. Now this is performed in clients with stiffened valves, which is called stenosis, or leaky valves, which is called regurgitation. And this can be the aortic valves, the mitral valves. And when non-surgical interventions, meaning medications, are no longer working, we have to progress to surgical intervention. Now, these can be mechanical heart valves or biologic heart valves that we're implementing in these clients. Some of these biological sources can be things like bovine, porcine, or even cadaver tissues for these heart valves. Now, clients who receive this, the mechanical heart valves, are going to require lifelong anticoagulation therapy, which warfarin is going to be the gold standard here. The artificial surfaces of these mechanical heart valves do have a tendency and a high potential to collect thrombi over time, which is dangerous in and of itself, but those thrombi can also embolize, go places like our lungs, cause a PE, go to our brain, cause a stroke. So we want to make sure they're on anticoagulants, and warfarin is going to be the best of the best here. 2, 3, and 4 are incorrect options. So 2 is dabigatran. This is a direct thrombin inhibitor. It actually increases the client's risk for stroke and bleeding, specifically in clients with mechanical heart valves. Studies have shown a higher number of thromboembolic events. So for that reason, it's actually contraindicated. 3, tacrolimus is an anti-rejection medication. It's used to suppress the body's response to transplants, like a kidney transplant, maybe a bone marrow transplant, and prevent that graft versus host disease, but not applicable for a mechanical heart valve. And lastly, apixaban. This is not typically used in the treatment of mechanical heart valves. It's more commonly used for the treatment of atrial fibrillation, or AFib, or a DVT being a deep vein thrombosis. So I see a lot of people say that mechanical valves have sticky surfaces. This is a great way to remember this. Alrighty, so option 1, warfarin, was our correct option. Alrighty, so question number 4, we are halfway there, guys. Y'all are doing fabulous. The nurse is teaching a client who has a new mechanical heart valve and is taking warfarin. Which of the following information should the nurse include? Select all that apply. Alrighty, so we have request prophylactic antibiotics before any invasive dental procedures. Notify your healthcare provider if you develop flu-like symptoms. 3 is take naproxen to relieve minor aches and pains. Or 4, schedule routine monitoring of your INR. And 5, avoid using an electric razor to shave. Alrighty, drop those answers in the chat. And a reminder that we are live, oh my gosh, I lose count, 6 times a week now. We have added evening lives on Wednesday and Friday at 7 p.m. with Nurse Andrew. He is the absolute best. We're really looking to add some more times because I know a lot of you are pretty preoccupied in the day with work, with school, so we want to add some nighttime lives. If there's another time that you feel like hasn't really been used enough, maybe an earlier one in the morning, please let us know what times you would like to see us go live. Right now, we either go live at noon on Tuesdays with our lecture session. We're back on Wednesday at 11 a.m. and 7 p.m. We're back on Thursday at 11 p.m. and 3 p.m. And we're back on Friday at 7 p.m. So if there's any other times you think would be better or more beneficial, please let us know. Drop it in the chat. Alright, doing fabulous. And I see a lot of correct answers. It looks like a couple people mixed 5 in here, and we're going to get to that. I feel like a lot of people that chose 5 maybe didn't read it in full. So our correct options were 1, 2, and 4, not 5. So again, heart valve replacement, we just talked about that in our prior question, but we perform this in clients with stiffened valves, which would be stenosis, or leaky valves called regurgitation. It can be the aortic or the mitral valves. This only happens when those non-surgical interventions like medications are no longer effective. We have to escalate to surgical intervention. Now, the mechanical heart valve clients are going to require lifelong anticoagulation therapy because, again, the artificial surfaces of those mechanical valves have a really high potential to collect thrombi. So we know they're going to be on anticoagulants. If a client is on anticoagulants, we need to make sure we follow bleeding precautions. And if they have this mechanical heart valve, we really worry about something called infective endocarditis, when that bacteria can get in and infect the inner lining of the heart. So a couple key things we have to look out for, which is going to inform our answer. So option 1 was correct. Request prophylactic antibiotics before any invasive dental procedure. This is true. We would have to use these before invasive dental, invasive respiratory kind of procedures, even if it's just a routine dental cleaning, because this helps to prevent that infective endocarditis, that bacteria that's being introduced to your mouth in a dental procedure or your airway in a respiratory procedure can travel into the heart and infect it. So we don't want that. Option 2, notify your healthcare provider if you develop flu-like symptoms. This is the same teaching point. We're really worried about that infected endocarditis. Flu-like symptoms need to be reported. This can include things like fever, aching joints, kind of those classic flu symptoms. Alrighty, and then option 4 was also our final correct option: schedule routine monitoring of your INR. They're going to be on that lifelong anticoagulation therapy. They mentioned in the question they're taking warfarin, which we discussed in the prior question. We will need to monitor those labs. PT, INR is going to be really important just to make sure they're staying within a therapeutic range. Now, 3 and 5 were our incorrect options. So this client is taking warfarin. We know it's an anticoagulant. Concurrent use of NSAIDs with the warfarin. This can be naproxen. This can be celecoxib. These need to be avoided because of the increased risk of bleeding. Again, we want to make sure we avoid that, taking them concurrently. And lastly, 5, avoid using an electric razor to shave. We want to implement these bleeding precautions, and part of those is the electric razor. Now, I feel like a lot of you guys who chose this maybe just didn't read it. You didn't see that it was negatively worded with avoid using an electric razor. My biggest tip forever on the NCLEX will always be slow down, read the question in full, read all of the answer options in full. The NCLEX loves to work in a double negative or an avoid or a follow-up or things that are negatively worded, meaning we're looking for incorrect options. So make sure you guys really watch that closely, especially if it's information that you know so well. I don't want you to make a preventable mistake by just flying through it. So again, we want to use those bleeding precautions, being electric razor we would want to use, not avoiding it. And we'd want to use things like a soft bristle toothbrush and avoid contact sports. So again, 1, 2, and 4 were our correct options. Alrighty, so question number 5. The nurse is reviewing new medication prescriptions for a client at 29 weeks gestation who is experiencing preterm labor. The nurse should clarify the prescription for magnesium sulfate, betamethasone, indomethacin, or doxycycline. Drop those answers in the chat. Someone's saying they don't understand why 5 was wrong. 5 in the last question was wrong because it said avoid using the electric razor. Bleeding precautions mean we avoid using a regular or a straight edge razor. Electric razors are actually safer and you have a lower chance of cutting yourself or nicking your skin, which means we would want to use that for a client on bleeding precautions. The option stated that we wanted to avoid it, which would be incorrect. It's tricky, but you got to make sure you look at the details, and the NCLEX will definitely try and trip you up a little bit. But I know you guys are ready for it. And just in case you guys are still weighing options for who to choose for your test preparation platform, UWorld does offer a lot of free resources. Obviously, you found one if you're here watching our live. We also offer question of the days on our social media channels. We offer a question of the week, which you can subscribe to and get it sent straight to your email every single week. If you visit uworldnursing.com, there is a link to our question of the week feature. And in addition to that, we are offering a free trial. So we have a 7-day free trial, all things that you can use to get acquainted with UWorld and to help make your decision on which platform you want to go with. But I would definitely recommend that everyone uses a trusted test prep platform to prepare for the NCLEX. I would not recommend winging it. Alrighty. Way to go, you guys. Lots of great answers. Alrighty, so our correct option here was doxycycline, and it looks like a lot of you guys already understand the teaching point here, but we're reviewing new medication prescriptions. This client's at 29 weeks gestation and they're experiencing preterm labor. So remember that pregnancy is 40 weeks. That's the fullest term you can go to. Well, I guess you can go past that, but anyway, preterm labor, we are super premature. We're trying to get to 40. We're only at 29 weeks. There's a couple of things we can do to help prepare the fetus for birth if unfortunately birth is imminent at 29 weeks. And a couple of things we can do to kind of help try and stall or prevent or push off this preterm labor. So doxycycline is our incorrect medication, therefore we have to clarify it because it's a tetracycline antibiotic. It is not safe for use in pregnancy. It should not be given to a pregnant client or a client that's considering becoming pregnant. It can pass through that placental barrier and cause fetal harm. Side effects include things like irregular development of the fetal teeth. It can stain them and impair the development of those fetal long bones. So doxycycline is incorrect. This is not safe for the client. Option 1, 2, and 3 are correct things that we can give. They're actually all indicated for preterm labor, therefore they don't require clarification. So option 1, mag sulfate is going to be given via IV drip. It is neuroprotective, so it essentially protects this fetus against cerebral palsy, and it's indicated for use in preterm labor. It also has indications in preeclampsia, and if you guys are curious about that, we have a really great maternal health lecture that talks about those hypertensive disorders of pregnancy. Go to our YouTube channel to find it. Option 2, betamethasone. This is a steroid. What it does is it's given via an IM shot. In a perfect world, we give this in 2 doses via IM shot that are 24 hours apart. In reality, sometimes preterm labor will progress so quickly that we don't have 24 hours to wait. And in that case, the provider may prescribe it to be given more frequently or a smaller interval in between. But it helps those fetal lungs develop. Again, those fetal lungs don't always develop until 36, 37 weeks. So we really want to make sure at 29 weeks, this is a very, very early baby. We want to make sure we're developing, we're strengthening those lungs as much as we can so they have the best shot at being able to work independently once they are born. And lastly, indomethacin, this is an NSAID. It helps prevent prostaglandin production, which helps to relax the smooth muscle of the uterus. Again, we want to make sure we're ceasing contractions. In an ideal world, we'd be able to stop this preterm labor, but I'm an OB nurse. Anyone that's worked in an OB setting knows that some people, some clients, that preterm labor, if the body wants to go into labor, it's gonna go into labor and you can't always stop it. But this is not only indicated for the treatment of preterm labor, it's also safe to give under 32 weeks of gestation. And this client is at 29, so that's totally fine. Alrighty, moving on. Question number 6. Y'all are doing great today. Someone says, good morning, ma'am. It is afternoon here, but I am glad we can be here when you are waking up. And I do see a couple people say, oh, I didn't realize it said clarify. I read it wrong. That has absolutely happened to all of us, but just another reminder that the best thing you can do on your NCLEX, as nervous as you may be to take it, is slow down and make sure you understand what the question was asking before you go in and start filling in answers. Alrighty, so here we have the nurses caring for a client with bipolar 1 disorder who is receiving lithium. The nurse should recognize which of the following are risk factors for developing lithium toxicity. Select all that apply. So a mental health pharmacology question here. Our options are dehydration, hyperkalemia, hyponatremia, hepatic cirrhosis, and AKI or acute kidney injury. Alrighty, and for anyone that's still in nursing school and is not graduating yet, I know we've asked a lot about testing and graduating, but if you're still in nursing school, what are your summer plans? Are you going to summer school? Are you working? Are you going to go on a fun vacation? Let us know what your summer plans are. It's the end of the week. I feel like we could all use a little something fun to talk about. So let us know if anyone's going on any fun vacations or cool trips. Or just hanging out at home. That's cool too. Alrighty, great job, you guys. I see lots of answers coming in, and it looks like the bulk of you got the right answers, just kind of in different variations. So our correct options were 1, 3, and 5. This is kind of a tricky question. Mental health is a tricky concept, and I think the pharmacology for a lot of the mental health medications is tricky because there are so many really, really extreme adverse effects. So lithium is a mood stabilizer. It's used in the treatment of bipolar 1 disorder. The thing about lithium is it has a very narrow therapeutic index, so we have to monitor these clients really frequently to ensure that they're not developing lithium toxicity, which again is just the toxic buildup of that lithium in the blood. Risk factors or potential causes of lithium toxicity are going to be anything that include dehydration, hyponatremia or low sodium, AKI or acute kidney injury. Think essentially about any issues with filtering or diluting. Those are going to be our big causes for lithium toxicity. So in this case, dehydration and that hyponatremia will trigger the release of ADH, which is antidiuretic hormone, which causes the renal reabsorption of sodium, of water, as well as lithium, i.e. that lithium toxicity. This can lead to those increased serum lithium levels and give this client, put them into a lithium toxic state. To prevent this, we want to make sure these clients are drinking enough fluids. We would encourage 2 to 3 liters of water a day. early manifestations of lithium toxicity will include things like GI symptoms, nausea, vomiting, diarrhea. Later manifestations get a little more serious. We move into dysrhythmias and even the potential for neurological signs like agitation, slurred speech, tremor that even progresses to seizure activity. So again, 1, 3, and 5 are our correct options because they denote dilution or filtration issues. 2 and 4 were incorrect, so these are unrelated. Now, I know hyperkalemia may be a little bit confusing to you guys. Even though hyperkalemia may indicate kidney problems, it's not a standalone risk factor. So if hyperkalemia was resulting from a kidney injury, that would be a risk factor, but just standalone hyperkalemia will not affect this. So that can be a confusing one, but I hope that makes sense to you all. And same thing for hepatic cirrhosis, this would not be related. So 1, 3, and 5 are our correct options, our risk factors for lithium toxicity. Okie dokie, question number 7. The nurses taught the parents of preschool-aged children about childhood growth and development. Which of the following statements by a parent would indicate a correct understanding of the teaching? Select all that apply. So here, I should notify our healthcare provider if my child is not toilet trained by 24 months. I can expect my child to be able to sit quietly for at least 30 minutes at a time. My child should be able to independently turn the pages of a favorite book. 4, my child should be able to communicate using at least 3-word sentences. And 5, I should encourage my child to assist with household tasks. I think someone's asking about our 5/19 session. It is live. That is next Monday with the NSNA. You can go to our social media to go to the link to register. We're really excited about this. Again, it's on Monday at 11 to 1 p.m. Central Standard Time. Go to UWorld Nursing on whatever social media channel you prefer, maybe Instagram, maybe TikTok, maybe Facebook, and you'll be able to see the link to our live lecture. It's with the NSNA. It is $25 for NSNA members and $35 for non-members. But if you are interested in joining us, we would love, love, love to have you. Alrighty, and all the information you need is on, I think Instagram and TikTok are going to be the easiest ways to get there. Alrighty, great job, you guys. Lots of answers coming in. Again, make sure you tune in next week. We have one more live this week, tomorrow at 7 p.m. with Nurse Andrew. That's Central Time. And then we start all over again next week. It never ends. Alrighty, guys. Great answers. Okie doke. Maybe 5. I understand. I like when people talk through their thought process here. But our correct answers were going to be 3, 4, and 5. So a reminder here, preschool age is going to be ages 3 to 5. So these are pretty young pediatric clients. This age is all about control. These pediatric clients are learning to control their body, interact, cooperate, be able to separate a little bit from their parents. We're looking at language and attention and memory improvements. Essentially, it's all about getting these kids ready to go and be successful at school. Alrighty, so option 3, 4, and 5 are our correct statements. They indicate correct understanding. My child should be able to independently turn the pages of a favorite book. This is true. They're not going to be able to read yet, but they should be able to turn the pages. 4, be able to communicate using at least 3-word sentences. This is true. You can remember 3 years old, we're getting to those 3-word sentences. So this is indeed correct. Lastly, 5, I should encourage my child to assist with household tasks. This is also true. We want to make sure we're kind of ingratiating this child in normal everyday tasks, getting them involved. They're all kind of wanting control. They're wanting to have more responsibility. So we need to make sure we encourage that autonomy and include them in some of these things. 1 and 2 were incorrect. So why is this? I should notify our healthcare provider if my child is not toilet trained by 24 months. Toilet training will happen between 2 to 3 years of age. So at 24 months, that's just at that 2-year mark. If it hasn't happened yet, we're not concerned yet. There's still some time. If we pass that 3-year mark and still nothing, then we would start to worry. But at 2 years, you're still doing okay. Also, different children will develop at different rates. Typically, girls develop a little quicker than boys do. But again, 2 to 3 is that sweet spot for toilet training. 2 is I can expect my child to be able to sit quietly for at least 30 minutes at a time. I don't know how much time you guys have spent around 3 to 5-year-olds, but I feel like they don't even sit still for like 5 minutes. Normally at this point, maybe we can get 15 minutes, but 30 minutes of sitting still, sitting quietly isn't going to happen till around 10 years of age. So at 3 to 5, we're definitely not going to expect this. So again, 3, 4, and 5 were our correct answers, which makes sense because preschool age children are 3, 4, and 5. Alrighty, last question. Okie doke, guys. The nurse is teaching a client who has a fractured right femur and is ambulating with crutches. Which of the following information should the nurse include? Place the crutches 24 inches, which is 61 centimeters, in front of your foot when walking. Ask your caregiver to stand on your unaffected side when you are walking. Move your unaffected leg to the next step first when descending the stairs. And lastly, 4, adjust the height of the crutches so the crutch pads are 2 to 3 finger widths below your axillae. Someone said she can't see the last question. It might be because my head's in the way, so I'll move. But again, this is a crutch question. These ones, even though they seem pretty simple, are hard to put into words and they're hard to answer as questions. So the best thing you can do is just kind of visualize it in your head and then do your best to translate that into how you would describe it in words. Alrighty, but last chance. Follow us at UWorld Nursing. Check out uworldnursing.com and subscribe to get updates on when we go live and what topics we do. And join us next week on Monday from 11 to 1 Central Time for our NSNA webinar. Lots of exciting things going on. Alrighty. Someone said up with the good, down with the bad. That's a great way to remember it. Lots of great answers, almost all option number 4, which was correct. Way to go, you guys. So in this case, option 4 is correct. We want to make sure we're not jamming those crutches up into the armpits or the axillae. This is potentially going to cause nerve damage. We're going to do about 2 to 3 finger widths down to prevent that nerve damage, also to be a little bit more comfortable. So 1, 2, and 3 were our incorrect option. Why was this? Placing the crutches 24 inches in front of you is going to be too far in front. It's not going to promote balance. This client's not going to be very stable. In reality, this is too far. We would prefer it to be about 12 inches or 1 foot in front. Option 2, ask the caregiver to stand on your unaffected side. You want them on your weak side, which is your affected side. Your unaffected side is your strong side. So we don't want that. Lastly, 3, move your unaffected leg to the next step first when descending the stairs. You move your crutches first. And speaking of that, we have a diagram. Again, go ahead and screenshot this, take it with you. Any of these resources, we are totally fine with you guys screenshotting, taking a picture, save it for your future studies. But here is a diagram of how we go up the stairs versus how we go down, meaning how we ascend versus how we descend. I'll give you a few seconds to go ahead and grab this guy before we move on, but you all did so well. Make sure you tell us how many questions out of 8 you all got correct today. It looks like you guys really did well. And thank you so much for joining. Visit uworldnursing.com for more information on all things nursing social. And I hope you guys join us tomorrow night at 7 p.m. with Nurse Andrew or anytime